Hey everybody, it's Jenny. Okay, so I'm back and I'm feeling better. I am done with my medication. I'm done packing, thank goodness. And last Thursday, I went to get all marked up for my radiation and all that stuff, and it was quick and easy. I went and got molded for this. They lay this thing over your chest and they mold it to the side that they're going to do radiation on. So when the radiation beam hits you, it kind of disperses right there and then goes out. I got lovely tattoos. Lovely tattoos. I'm going to see if I can show you. I'm just going to show you the one on my stomach. I don't know if you can see that. It's right there. I have 6 of them. I have 6 of them on me. And they're permanent. They're not going anywhere. Like I said, I mean, at the end of this journey, I'm going to be so marked up, it's not even going to matter to me. Let's see. I go in on Tuesday, and I'll be going Monday through Friday for 5 weeks. I think the thing that I'm having the most anxiety about is just being away from my family, because I don't want to drive back and forth every day to do radiation, especially if radiation is only going to be 20-30 minutes long. It's over an hour drive and blah. Luckily for me, my best friend's going to be, she works out here now, so she'll be here at the house during the day, kind of keeping an eye on things, and the only thing she'll do when she's here really is take Devin to school. When she gets off work, she comes over here, she'll take Devin to school, and then she'll pick him up and take him to Chris's house, and really that's about it. And if she can't pick him up, then I have other friends like Donna, Renee, Bertha. Those people will always, they've been helping me out so much, and without those women, I would not be able to have gotten through the last 7 months, almost 8 months now. Oh my goodness. They've just, every time I've asked them for help, they've always said yes without hesitation. And ladies, I want you to know that if y'all ever get sick or ever need me and I'm capable, I'll be more than happy to help out. I am so indebted to you women, and I'm just so thankful to have met you, and that you're a part of my life, and that you are amazing. Truly, from the bottom of my heart, thank you, thank you. I am nervous towards the end of it, because I hear towards the end of treatment is when you burn, like when it all starts just catching up with you. I'm interested to see if I get tired. I heard that it's a different kind of tired than chemotherapy, and I got really tired during chemo. So, but I'll be staying with my mom, and that'll be good because I can help her with her house. I can just visit with her. I can just spend that time with my mom, and I'm looking forward to that. I'm just not looking forward to being away from Chris and Devin for so long. I think that 5 weeks, I know 5 weeks is the longest I've ever been without my husband. I will be coming home on the weekends, but it'll be too short and too sweet for me to handle. And Caden has been showing signs of separation anxiety, so that's been rough. I think just the fact that we've been, with the surgery and then the infections and everything, we've been away, we've been split up as a family a lot the last almost 2 months, and it's just been really taking a toll on the baby. So I'm looking forward to radiation being done and hopefully getting some order back in the house, because then after radiation will come my hysterectomy, and then after the hysterectomy will come my reconstruction. And then the plastic surgeon said that there's another surgery that he likes to do after that reconstruction, just to kind of tweak things and make them look good. I'm looking forward to the new body, because once I get the new body, that means that I'll be able to lose weight. I've put on almost 30 pounds. I'm pretty sure 30 pounds since I started. And surprisingly, I'm not alone. There are a lot of breast cancer patients who gain a lot of weight during chemo. Just, I think a lot of it is the steroids and just being so tired, and it's a combination of things. But I've heard several women talking about weight gain during chemotherapy. So cancer just has a way, for me, breast cancer has had a way of really messing with my psyche as far as my body image goes. I've never felt comfortable in my body before. And then I lost all of that weight, and I was so thin, and I was so healthy, I was strong. And then I got cancer, and it took my hair. Now it's taken my breast. And I'm not your typical breast cancer patient. A lot of women will go in and have the surgery and have immediate reconstruction, and they'll have the scars across their chest. But with me, we did the skin spraying surgery, so it leaves a lot of loose skin on my chest, and it's ugly. I feel, on top of the hair loss, the weight gain, now my breasts looking the way they are, I feel ugly. I know I'm not. I know that a lot of people will tell me that I'm beautiful and everything, and there are moments where I see myself as still pretty, but I think once I have the reconstruction and I'm able to lose the weight again, I'll feel a million times better. And with my hair, it is getting quite long. I can reach up and grab a little bit, and it's a lot lighter. You can still see my scalp quite a bit, but it's getting so much better and so much longer. The reason I can't lose weight right now is my plastic surgeon has told me to not lose a whole lot, not gain a whole lot, because I'm kind of in that sweet spot, because we're doing the lat band reconstruction, not lat band, deep flap reconstruction, there you go. Because we're doing the deep flap reconstruction, he's going to be taking the skin and the fat and possibly some of my muscle from my stomach to make my new breast. I don't think he'll need to use a whole lot of my skin because of the skin sparing surgery that I had, but he'll definitely need the fat. I want to get around a C cup. I think a C cup is perfect. I've been a double D my whole life, and I kind of want small, perky, pretty boobs. And then after my reconstruction, the last tweaking that I'm going to do is I'm going to try and go Dean and have him tattoo some nipples on me. So that should be interesting. Dean said he'd be more than happy to do that, and hopefully maybe a discount. No, I want them to look pretty, and I know that Dean will do a great job. My pain has gotten really good, although right here, like these are my chesticles. Right here, I am having it just feels like muscle soreness, like cramps. I don't know, it's just like if I move a certain way or I move my head a certain way, and I think a lot of it is because I've been doing stretches. Like I can lift my arms up, it's a little tight right here, but nothing too uncomfortable. The back of my arms hurt still. I think I still have some marker from the tattooing that they did. I swear I just took a bath. But when I first had my surgery, from here all the way to here, if I extended my arm, it hurt so bad. But now I can turn it and it doesn't hurt. But the back right here, all right here, and all right here are really sensitive. And you would be surprised with how many people will come up and grab the back of your arm or try and give you a side hug because they know you just had a double mastectomy, and they'll give you a side hug and grab that arm, and it hurts. It hurts. Please, if you see me and you want to give me a hug, that's fine. Don't grab my arms. Don't hit me in the head. Don't spit on me. Just give me a hug. And just be mindful that I have a lot of nerve damage still, and yeah, I think that's pretty much it, because what normal breast cancer patients, what they do is they cut out the breast tissue, so you have that huge incision line right there, and then they go in and cut right here to take the lymph nodes out. But what my doctor did was she went in through the nipple, up into there and dug out my lymph nodes. So I only have one scar, and it's right here. See, I have, like, that's a piece of loose skin, and that's a piece, like, I'm not going to show you, but I'll show you through my shirt. Like, that's loose skin. That's, and it goes deep, and then this side is the side I had the infection on, and it's a hot mess. It's so nasty. But this too shall pass. I'm not always going to have this chest. We're going to do the reconstruction, and it's going to be beautiful. Even if I'm lopsided, even if if they turn out to not be as big as I want them to be. I know at the end of this I'm going to feel a lot better about myself, especially once I can start losing the weight. And it's killing me because I want to like go for walks and bike rides and start all of this stuff. My biggest meltdown as far as my physical activity is my weightlifting. Before I got breast cancer, I bought a barbell, and I was super excited because on Fitocracy you get more points by lifting. And I was so excited to get my barbell, and now everyone is telling me I can't lift. And if I do, it will be many years from now once I recover from all my surgeries. I have had so many breakdowns in the doctor's office because they're telling me I can't use my barbell. They've given me permission to use 2-pound bells, but I think the Fitocracy community will laugh at me for logging 2-pound exercises, but pretty much everyone on Fitocracy knows that I have breast cancer and what I've been going through, because everyone on there is still so supported, even though the most I've logged is I think a 20-minute walk. I think, yeah. I mean, they don't care. They don't care if all I log is my stretching for my physical therapy. They prop me. Phyto is so amazing. If you're exercising and you're wanting to lose that weight, get on the Fitocracy. It's free. The support there is amazing. I'm Coop Dizzle on Fitocracy if you ever go there. So not much has really been going on as far as my last update with my infection. I'm feeling so much better. The next part of the journey is radiation, so wish me luck. And before I go, there's a woman on YouTube, Christina Newman. I have been following her since I found out I had breast cancer, and she is so strong. She has triple negative breast cancer. She has a 1-year-old, and I think her daughter's 21. She's older. But Christina got pregnant with Ava when she was in the middle of chemotherapy. And I mean, Christina and Ava and her other daughter, it escapes me at the moment. I will think of it as soon as I turn off the camera. And then her husband, Ernie. Such a beautiful family. She's been doing low-dose chemotherapy for the last few weeks. It came back in her liver. One of the many places it came back was in her liver. And I think she said in one of her vlogs that her tumor is the size of a basketball. And if you were to take if you were to take her liver out right now and weigh it, I think they measured it at 30 pounds. Huge liver right now. So she's been doing very low dose chemotherapy, and it hasn't worked. And she went into the hospital late last week, and they're putting her in hospice. They are doing a alternative medication and hoping, but that's kind of like the last thing on the menu. And I'm absolutely heartbroken. If she passes away, this will be the second woman that I know of with triple negative breast cancer who's passed away since I got diagnosed. And it really does a number on your head when people with the same type of cancer pass away. So if you can, keep her in your prayers, keep her family in your prayers, and just make sure that you hug your loved ones, because you could be happy and peaceful and everything going right, and then the next day you get told you have cancer or some awful thing happens. Life is so short and so precious. Don't let it pass you by. But that's the end of my video. I really wanted to address Christina. She's been on my mind a lot lately. And yeah, check your boobs, check your balls. And when you get really nervous because radiation is fixing to start, just think, This too shall pass, and you'll be with your family every day again. Bye, guys. I love you.